Hello, everyone. Welcome to another episode of our Health Matters. This is a channel where medical conditions are explained in simple English. We do not use medical jargons here. Sometimes in some of our videos, you hear us using pidgin English. So just to let you know, so you could be saying pidgin English or simple English, just simple English, no medical jargon. Yes, you heard me right. That is it. So you are welcome. If this is your first time of tuning in, of watching with us, we advise you, in order for you to become a member of this wonderful health awareness family, all you need to do is subscribe to our channel, hit the like button, and click on the notification bell. So you will be notified once our videos are released. And to our returning subscribers, you're all welcome. Very warm welcome to you all. You know what to do at the end of this video. Do not forget to like and share. Like and share. So that's all you need to do. And to our new viewers, that is all we ask for. Subscribe. Make sure you invite 5 people to subscribe with you. Automatically, once that is done, you become a member. So that is all we ask from you. So today was our topic. As you could see on the screen, our topic today is we're going to be looking at the differences between a primary healthcare services and the secondary healthcare services in Edo State, in Nigeria, in Africa. So we're going to be looking at it generally. Why are we going to talk about Edo State today is because we did a research in Edo State and we find some results, some disturbing results, which is why we really want to start with Edo State. So moving on. Before we start, there's something we always do. It's like our national anthem. Our national anthem. So we normally say it every day. In all our videos, you see it. Before, in our past video, we just put it there as a write-up so everyone could read. But now we want people to actually hear it from us, and then we explain it in a very simple way. And what is that? That is our practice policy. Our practice policy states that every information, whatever you hear from us here, is only for health awareness purpose only. It is not meant to represent or medical diagnosis, medical treatment, or medical advice from your medical doctor. So if you have any medical matter, medical concern, medical queries, please do not hesitate to contact your doctor ASAP. That's ASAP, as soon as possible. So moving on, let's dive in straight into our topic of today, which is we're going to be looking at the difference between a primary healthcare and the secondary healthcare in Edo State. And while we are looking at it in Edo State, at the same time, we'll be looking at it generally in Nigeria. Why are we going to look at it from the whole Nigeria perspective? Is as a result of the news that came to us, which concerns one of our noble Edo-born singer. The story was so touching. So that's him there. That's Raymond. He's a singer. He lost his senior brother to Nigerian bad healthcare practice. And what is this bad healthcare practice? His brother went in for a medical surgery, and then accidentally, like we all know, NEPA don't sees light again. No. So NEPA sees light. Whether it's NEPA in Benin, I've forgotten the new Edo name, but we still call them NEPA because that is what most of us are used to. So Raymond's senior brother was in the hospital and he was to undergo a medical surgery that was planned. And then during this period, while they were during this process of doing the surgery, the light went off. And when the light went off, the next thing they did was to use a candle light to continue with the surgery. And at the end, there was a wrong, I would say, yeah, there was a mistake, and the young man bled to death. So to Rima, He was depressed. He's so sad. He felt bad. You could see even him sitting down here. So he's still going through the pain of his brother, of the death of his brother. And again, to the mother also, it's such a painful thing. Because to Rima, that's the senior brother. He looks up to him. And I wish he was alive to see the progress the junior brother have made. He would have been proud and say, yes, that's my kid brother. And again, Rima also will say, yeah, that's my big brother. But now today, his death has taken him away. And may his soul rest in perfect peace. And I pray that God will grant the family or the heart to bear the loss, because it's not really easy bearing loss or forgetting things like that, especially when he was a big guy. So it's so painful. It's very, very painful. Well, anyway, that's not where we're going to. Where we're going to is that so many people have lost their life as a result of these poor healthcare practices. I will call it malpractice, because that's malpractices that they are doing. How will you on earth you use a candlelight to continue with a medical surgery? Where are the generators? I know this all boils down to bad leadership, because in the Western world, you pay for your electricity and you get it. But from what I've understood, in Nigeria, you pay for your electricity, you don't get it. So who is fooling who? And who are the mumus? The mumus are the people. And that is why I am so much in support of EndSARS. EndSARS is not only about police brutality. No, it is not only about police brutality. It's about fake medical practice, fake leadership, bad governance, bad practice. In fact, it is about wickedness in high places in Nigeria, because it's getting too much. And we really need to stand up and speak up. But one thing for sure that I believe in, that's my principle of getting the truth, is that we can never achieve this with violence, but we can achieve it on a round table talk. So I am not saying, yes, go out there to continue with fighting or rioting. No, but there is a way, different ways we can actually protest. We can do protest online. You can do protest at home. You can do protest in anywhere. We can do it. And we need to really come together and do this. When it comes to protest with regards to healthcare, please, you guys, if you're listening to me, you have my details. You have this my contact address at the end of this video. Please make sure you get in touch with me, and I would love to be part of that healthcare or medical healthcare in Nigeria protest. I would really want to be part of it. Though I am part of every other protest they are doing, but to be fully immersed when it's healthcare, I will speak up, and I have examples, and I will be able to defend whatever my mission is or whatever my vision is. So moving on, like I said, Rema's senior brother died of a medical of a bad practice, of a bad medical healthcare practice. Medical surgery being carried out using a candlelight. When I heard it, I said, seriously, could this be true? And I went further to do my research, and I found out that it was actually true. Why on earth will a medical doctor continue a surgery? Why, when there is no light, why will you continue with a candlelight? Don't you have a generator? Seriously, you used candlelight? Oh my God. So, well, it has happened. And like I said, may his soul rest in perfect peace. But we need to stand up against these bad healthcare practices in Nigeria. It's getting too much. So we're going to be looking at so many things, because why I brought up this topic is, if in the event of Rema's senior brother, if they had known what to do, they will not go straight to a roadside hospital. If they know what to do, maybe, yes, I know people can say I'm this and that. We Nigerians, we are good at, placing ourselves up there when we are actually not. Unless when like they say, when breeze blow, foul nyash go open. That is when you really find out the truth about some people, including medical doctors. Fine. So if they had gone to a big hospital, I don't think when NEPA did their deed by seizing the light, I don't think they would have gotten to that stage of losing that gentleman. So please, please, please listen to this video very well, and at the end, I know you're going to benefit from it. You will surely benefit from it. So now let's dive into our topic of today, so that next time you will not make the mistake of going to the wrong healthcare practice. Yeah, you won't go to the healthcare, or you won't go to the wrong healthcare practice to seek for medical help. If you know the difference, you will know what to do. So in Nigeria, or in the whole world, is a system. There is what we call primary health care, secondary health care, and a tertiary health care. I'm going to let you all see it. So now, this is an example of a primary health care. This one was newly built at Ekeadolo in Edo State. You can see it's written the Ekeadolo PHC. The P stands for primary, the H stands for health, and the C stands for care. So this is a primary health care center at Ekeadolo. This is a primary health care center at Ekeadolo. I just repeated myself now because I want you to listen carefully. This is not a specialist hospital. No, this is a primary health care center at Ekeadolo village. It's not my village, I'm sorry. Ekeadolo is no more a village. It's now Benin City, because it's now Benin. It's not part of the Benin City. I don't know. Sorry, pardon my saying. I'm not trying to pull anything down anyway. So this is what a primary healthcare center looks like. And in a primary healthcare center, it is divided into different sections. That is, we have primary healthcare, and then we see that primary healthcare now is still divided into sections, which I'm going to explain to you. But before I explain that, let me tell you what's a primary healthcare. Primary healthcare is the front door of healthcare. The front door of medical care. That is the first place you go to, the place you knock on the door. That's the first door you knock on when you have any medical concern or medical matter. That is where you go to. And then you now also have you get some community health center. They all fall under primary health care. Now let's go and divide the primary health care. First part of primary health care, that's the section 1, like I said, the community health center. This community health center is normally what we get in the villages, though I heard that there's no more village like that in Edo State, which I'm so happy about when I heard it. So this is what we get like in the villages. So in this community health center, who are the people there? You will meet a nurse. So what is the requirement is you must have one female nurse and one male nurse. And then you will also have a healthcare support workers. You will have a housekeeper, and then you have a multi-purpose worker. So now I will explain them to you. Do you know why you need a male nurse? A male nurse is required because there are some medical conditions when you want to examine some patient who and is a man. You actually need a man to examine the man, for that man patient to be very comfortable. So you need a male nurse. Though when one is in deliman, when one is in when man is in an ugly situation, like in the medical arena, though in medical, when it comes to medical talk, there's nothing like ugly or not ugly, but there are still some situations some people will be ashamed to open up themselves to the opposite sex. Like in the Western world, for a doctor to examine a woman, they actually need what we call chaperone to stand by the side of that doctor, so that the patient cannot come and say something else happened in the room. Though in Nigeria we don't get that, but in the Western world, before a male doctor we examine even a fellow male, there must be a chaperone there. The chaperone is the witness. The chaperone is who sees everything, which in this case of primary health care, the multipurpose worker can take the position of a chaperone. That is standing as a witness. So in a community healthcare services, if a man walks in and the only person there is a nurse, the female nurse. The other female nurse can go in the room to go and stand there as a chaperone, so that the male patient will not say, oh, this nurse was touching my pen drive anyhow. And we know in Nigeria it is not very common to sue people, but in the Western world is a very common thing. Maybe if you want to check somebody and you don't check the patient properly, the patient will say, oh, you did touch him or her inappropriately, which is which is a very serious offense in the Western world. So that is why in a community health center, we need a medical nurse that one will be female and one will be a male nurse. And then we need midwives. These midwives, they are the people who attend to pregnant women. And then we need a healthcare support workers. These are, I don't really like it when they say auxiliary nurse, but though that's the English name, and that's what they are known as in Africa or in Nigeria. They call them auxiliary nurse. But here in the Western world, we call them healthcare support workers. And please, from henceforth, don't call them auxiliary nurse. They are healthcare professional support workers. Give them their name. Give them that name. They will like it. So it's like auxiliary kind of put them down. One day I was speaking with someone and I said, oh, are you a nurse? Oh, the person standing by said, no, I'm the qualified nurse here. She's an auxiliary nurse. So the auxiliary nurse wasn't happy. But I quickly jumped in and I made peace. How? I said, look, everyone is important, because the nurse cannot work fully without the help or the assistance of the auxiliary nurse. And in Western world, we don't call them auxiliary nurse, we call them healthcare professional support workers. And most of them are so well trained that if you don't look deep, you actually don't know the difference between them and a qualified nurse. And because they are well trained, nurses, they make the work of the nurses much easier for them, because they understand the language of the nurses. Like, oh my God, let me tell you something. Nurses in the UK, most of them do 12 hours. And sometimes when they go on duty, they give them a bay. And in that bay, maybe you have 6 patients, 7 patients there in a bay. Can only one nurse take care? No, the nurse need an assistant. So that's why we call them healthcare professional support workers. So these are people you will see in the community setting. Don't forget, we are still talking about primary healthcare center, primary healthcare services. So that's what we're still talking about. And I told you primary healthcare services is divided. So I'm dividing it. So the first one is the community center. And then the other one is the pharmacy. And I think there is a misunderstanding in Nigeria. That is why people are finding it difficult to differentiate between a patent medicine store and a pharmacy or a proper chemist. Now, I'm going to explain it in this video. Listen, pharmacy. In the UK, there is an aggressive campaign. Yes, an aggressive campaign. There is an aggressive campaign which is viral in the UK. What are they campaigning about? If you're not feeling well, if you're cold, if what we call minor ailments, if you are experiencing it, the first thing you do is you go to your pharmacy. When they say go to your pharmacy, they don't mean go to your patent medicine store. Like, we also have what we call drugstore. Like, you just walk in and say, oh, can I buy this? Some people sell what we call JSL. And JSL, these are what's a JSL? A JSL is general sales list, like paracetamol. You can buy it yourself. Even petrol station, you can go there and buy all these things. So these are like patent medicine store. They are not a pharmacy. But for under primary healthcare, patent medicine store does not fall under primary healthcare. What comes under primary healthcare is a proper pharmacy. And when you go to proper pharmacy, you get what is you speak with the pharmacist, not the counter assistant. Once you walked in the Western world, I'll use UK as an example because that's where I'm speaking from. Once you walk into the pharmacy in the UK, you explain yourself to the MCA, that's the medicine counter assistant. You explain to them, this is it, this is it. They have a set of questions they will ask you. They are also well trained. This MCA, they are well trained. They just, you can't just say, oh, I come and do MCA for you because I can sell, I know what the difference between paracetamol. No, you need to have a qualification for you to be for you to become an MCA. For you to be an MCA, you have to be well trained, and you need a certificate to prove it that you are trained. So moving on, when you come into the pharmacy, the MCA will interview you. There is what we call the WAM question, or ask method. They will follow this procedure, question you, and then if they see that is a situation they can help you with, they will tell you, okay, take paracetamol. They know their level, they will not pass there. No. Then there are some questions they will ask you. When they see that this question is going beyond, they say, hold on. They will now refer you to the pharmacist. It is the pharmacist now that will look at your situation. If it is the situation, if your condition is the type that the pharmacist can manage, they will manage it. If it is the type that the pharmacist look at and say, no, you need to go and see your GP, that is your house doctor, your general practitioner, they will refer you, go and see your general practitioner. If they see that it is the situation that you need to go to A&E, that is the secondary care, which we are going to talk about later, they will actually refer you back to go to A&E. So pharmacy falls under a primary health care. And not just pharmacy alone, going to see an optician. In Nigeria, in the UK, we have Specsavers, or we have Vision Express. We have so many. The people that care for the eye, and the only people that work in these places, they are opticians, they are optometrists, no, you get the ophthalmologist in the secondary care, we'll get there. So they are, you get optometrists there, you meet with opticians there. So you need to know the difference, and then that will help you to know where to go to. So that is it. For the eye center, they also come under the primary health care. They are on the high street. These are the people you see on the high street. But in Nigeria, our people are misplacing it. You see the way I explained that of the pharmacy, they don't really understand. So anywhere they see they are selling medicine, they go there. So that is why you see most people running to the patent medicine store, the roadside one. They run there, they run to the patent medicine store. Though I don't blame our patients who runs to the patent medicine store. The people I blame are the PCN of Nigeria, the Pharmaceutical Council of Nigeria. Why did I blame them? Because they are the leaders. He said, if the foundation be destroyed, what can the righteous do? Nothing. But now the righteous is going to do something, because we know God, who said he will never leave his children in the dark. So that's why we are bringing this awareness to you. If you are a member of PCN, if you are listening to this video and you know anybody from Pharmaceutical Council of Nigeria, please play this video for them. Let them hear it, because they need to differentiate between a patent medicine store and a pharmacy. Like I said, in the UK, you can go to the petrol station and you can buy paracetamol, you can buy APC, you can buy Imodium. Yes, there are some JSL medicines you can buy, even from the supermarket. You can buy what's it called? You can buy Imodium, all these JSL medicine. You can buy, sorry for the break anyway. So you can buy this JSL class of medication from a petrol station, from a supermarket. That does not make them a pharmacy. No, this is why I said I blame the Pharmaceutical Council of Nigeria, because they really need to stand up and make the difference clear, and let the people know the difference between a patent medicine store and a pharmacy store. You understand? We really need to know this difference, because pharmacists, they are well-trained healthcare professionals. They know the in and out of your medicines. They know. They know. They will tell you what the medicine will do to you and what your body will do back to the medicine. I tell you, when doctors here in the UK, when they are like, oh, they are confused with medicine, they are confused that a condition is challenging them, and they tried one medication, is not working. The next person they will call on the pharmacist and say, look, I am trying to use this medicine for this condition, it's not working. Is there any new one? Because because only the pharmacist, not only anyway, yeah, it's only, yeah, the pharmacist it is they, or it is them that know, it's the pharmacist that know that, okay, if you are trying to use this medicine for this will happen. Like they were talking about hydroxy chloroquine, whatever. Yes, using some certain medication, you need a teamwork. Like if you want to go on hydroxy, you need the optometrist to check you, you need the cardiologist, the pharmacist need to come in. What is the mechanism of action? These things need to be known before they can put you. So a patent medicine store will not tell you this. They don't know. Not that they don't want to tell you, because they will not tell you because they don't know. So we really need to sit down and say, what is the difference between a primary healthcare and a secondary healthcare? And I believe by the time you know, after this video, you will know what to do. So all I've been explaining since is about a primary health care. So like I said, on primary health care is divided into sections. You have the community services, you have the pharmacy, you have the opticians, that's the eye services, like in the UK, the Specsavers or Vision Express or Boots Vision, different one, Ideology, they are all there. So also there are vision care in Nigeria. So vision care fall under primary health care. Another one that falls under primary health care that you can easily get on the high street, the dental care. The dental care also fall under primary health care. So just, I'm not going to name all, I just want you to know. And in a proper, well-organized pharmacy, who are you going to meet there? One, you will meet with the pharmacist. You will meet with the healthcare support worker, like I said again, because there are some people who need to be trained to give an injections, like the nurses, and some pharmacists are trained to give injections. Yes. And then you also have the multi-purpose. Who are these multi-purpose? They are the one that will actually help you write, do paperwork and everything. And above it all, the most important people I know are very important are the housekeepers, because if these people are not there, infection will kill everybody. So they keep the healthcare settings, they keep it clean. They are the ones that are helping us. That is why infections are not caught in that area. So if you go to a poorly managed healthcare setting, people there are all prone to catching up with infection. You understand what I mean? So that is for primary health care. Now I'm going to move on to secondary health care. So what's the secondary health care? Now we have one beautiful one. Again, thanks to Governor Nogayase Obaseki. Though I'm not in Edo State, I'm not there, but I tell you, I have a program I'm running in Edo State, and I'm working with a lot. I work with different healthcare professionals. Let me leave it that way. So, and we normally use Edo State Specialist Hospital, and they recorded it and sent me the video. It's such a beautiful place and it's a clean environment. I really want to say thank you to the members working there. You guys are trying. I want you guys to keep it up and don't follow the normal procedure of our past leaders who doesn't believe in renovation, who doesn't believe in growing. Once you paint once, you just say, okay, that once you paint, that is the paint for life. There is nothing like retouching or refurbishing. They don't believe in that. So this is Edo Specialist Hospital. This is what we call secondary health Care Services Center. Yes, you heard me well. Edo Specialist Hospital is a secondary health care place, secondary health care center. And what is a secondary health care? When we say secondary health care, this is usually the second level. Don't forget, the primary is the first level. Secondary healthcare is the secondary level. In the Western world, I will also use UK again as an example. You only go there with referral, with referral. Not when you have headache, you say you are going there. No. Not when you say you have cold, you say, oh, you want to go there. No. That is not a secondary health care place. A secondary health care place is where you will meet with specialists. You know, when I mean specialist, I mean specialist. It is only when you need a specialist that you go there. Like after your general doctor, that's your general practitioner, he has looked at you and said, oh no, you need to go to the main hospital. Because if you go to the main hospital, that is where you will meet with a specialist who is specialized in attending to that particular condition that you are having. Fine. Who are these people that you meet in a specialist hospital that you will not meet in a primary care? Number one, neurosurgeons. You don't expect to see a neurosurgeon on a small clinic. Never. Cardiologist, ophthalmologist, endocrinologist, urologist, gastroenterologist, gynecologist, clinical pharmacists, specialist nurses, and many more. I don't want to keep mentioning pediatricians, dietitians. Yeah, though you can also meet a dietitian on the high street, which means in the primary care. You can also meet them there. They are also there also. You can also meet a clinical pharmacist on the high street, and you can also meet them at the secondary care level. So, but through assessment, your patient, your GP will be able to refer you for the secondary care, which is the main hospital. And then when the main hospital, they finished with you, they send you back to the primary care. And some primary care can also send you back to your community, like that one at Ekeadolo. So maybe you come to your doctor in Benin City, they've seen you, they've spoken to you, they will now say, okay, we are through with you, everything is okay. We are referring you back to your community center. Because why? The nurses there are capable and they will be able to help you carry on with managing with the condition. So that is the difference. And these are the people that you will meet at the secondary healthcare level. So please do not miss it up. I'm going to play a video for you now. The video I'm going to play for you is not going to take much of your time. It's about 3 minutes. Just watch it and I will talk along as the video is playing. So I just want you to understand properly what is the difference between a primary care and a secondary care, and what type of condition that you should take to a primary care or a secondary care. Now, the land of my birth, that is Nigeria, is what we are talking about today. So, the healthcare system in Nigeria, you need to be aware. If you are not aware, they will catch you mugu. Even some medical doctors, they will catch you mugus. You need to know what they are doing. Ask questions. If you don't ask questions in this country, this green, white, green land, oh my God, they will catch you mugu. You know what is mugu. So 419 is not only about cash alone. So we are actually looking at Nigerian healthcare in focus. In brackets, put Edo there because we've done our research in Benin. And presently, there's a research going on now in Lagos. And when we finish in Lagos, we are moving on to Ibadan. So it's round, but we started small in Edo State. So when you see a man falls down, maybe heart attack, you see a man, a big man falls down, or there is an accident, please, this is not for primary health care. Go straight to big hospital like Lutz. Yes, go to Lutz, go to ESH, Edo Specialist Hospital. If you see that your heart is pumping, it's like some people will say there is like fish, that is arrhythmia. Like if you feel you are having arrhythmia, go to the hospital. This is not for a primary health care. I know some people are thinking this woman is talking as if she's abroad. Please, if you have heart attack, go to the secondary care, go to the major hospital. This man had a heart attack. Thank God he was able to call with his mobile phone. If you have glaucoma, don't take it to any other person, take it to a specialist. If you go, don't go to your normal GP, no, go to an eye doctor. Ask, are you an eye doctor? You see, somebody like me, I can't try this now, choking needle in somebody's eye, but the professionals, they know what they are doing. They know. They operate cataract, they remove it from people's eyes, and then they put the eye back. Glaucoma, they manage it. Seek the help of a professional. Go to the right place. Know the difference. Don't give your eyes to a patent medicine storekeeper. Please, I hope their name will not cut my tongue. Don't give your eyes to a patent medicine store seller. No, they will destroy the eyes for you. There is a difference. There is what we call AMD, dry AMD, wet AMD. Which medicine is good for them? They know, the professionals know. Okay, look at this woman now. This is a diabetic foot. This diabetic foot, a patent boy or patent girl working in a chemist cannot just treat it because they don't know the powder, the right antibiotic powder to put. No, no, go to a specialist nurse. This is a specialist nurse working. Know your boundary. If you are not feeling well and there's something like cancer, you feel lump on your breast, go and meet with a specialist nurse. Go to the hospital. They will do a lab test, they will do a biopsy for you to know what is actually going on. You can't just say yes, you want to go and continue. No. So we're going back now to Edo Specialist. Yes, back to Edo Specialist Hospital. So all that, what you've just seen in that video, can only be achievable in a big hospital like this. Yes, you heard me right. In a big hospital like this. So please, 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 please wake up. Stop sleeping. Do not let people make yo-yo of you. Do not let people, do not let a patent medicine small girl, small boy make a yo-yo out of your life. Please. Now, I'll take you to something there. There's something I want to show you again. It's about, there was a video that I uploaded some time ago. This video is about sorry about that. So there was a video I uploaded some time ago. So this video was about a lady who was selling medicine inside the market in Benin City. Yes, because many people, they do it. They sell medicine in the market. And then while they were selling this medication, someone now asked two ladies, they come and say, madam, what do they do? So you say, now in they sell medicine for this market. Sorry, I'm jumping to pidgin English. Yeah, like I said, we cycle. The only thing I don't cycle into medical jargon, but I can cycle between a correct English and a pidgin English. It's allowed on this channel. Cycling between pidgin English and simple correct English, not the ogbonge one, no, the simple one. And then again, no medical jargon is allowed. So please, I didn't apologize me using a ophthalmologist, urologist. Those were medical jargons because you won't understand what they do. So, but if I have time, yeah, I will explain. And if you want to know more, you can also ask me. So let's move on. This lady was selling medicine in the market because the man said his body is always paining him. If you've not watched that video, I will advise you to go and watch it. It's a very short video, medicine seller. You'll see it. And then the lady there now ask, madam, what do you do so? And saying they sell medicine for her. You be pharmacist? He say, in learn and small. Pharmacy, you learn and small. Oh my God. I said, God, seriously? Oh no. Are you telling the truth? You learn am small. Oh my God, that's serious. Pharmacy wey be say 4 years, 5 years, people dey drag am to get the degree, to get masters in pharmacy. It's a battle. And then you say you learn am small. Who you learn small with? You understand? So please, my people, this is not I learn am small, and should not be entertained in any way. Do not entertain it. Do not let people make you of you. Let me tell you, in pharmacy, every medication you take, they look into it. There's nothing like I learn am small when it comes to pharmacy. No, no, there's nothing like I learn am small. You learn it, you learn it. You know it, you know it, because you know why. Intelligent questions will come your way, and you should give an intelligent answers. Someone will just come to you and said, "Oh, I'm taking a tamoxifen, and I want to also take a NSAID." Or someone will come to you and say, "Oh, I'm taking which example will I, yes, I'm taking for example, I'm asthmatic, and I want to also take a, I have problem with, I have pains, so I'm now thinking of taking a bisoprolol." Oh my God. Or someone will come to you and said, "Oh, he is hypertensive, and now he's having pain, he couldn't help it anymore. He's going to take NSAID, like Ireli cap in Nigeria, Fedo cap, ibuprofen, something cap, and da. You understand? They want to take this class of drug. The pharmacist will be able to tell you the interaction. That one a medical jargon anyway. I not sabi. Okay, I can explain it. I know it's a medical jargon. Interaction, yes. What's interaction? Let me say it. I'm going to explain this in pidgin English. The pharmacist will be able to tell you. I say I want change. I dey speak correct English again. Pharmacist go fit tell you whether the two drug, the two medicine where you want take together, whether they go fight. Una know as when one man marry two wives. When one man is married to two wives, I'm cycling, don't worry. If you don't get the whole gist of this video, if you have question, leave your question in the comment box below. I'll get back to you. I really want to drive the message home to my people. That's why I'm cycling between pidgin English and correct English. So now I'm going to explain this particular place I'm explaining now. This particular point, I have to say it in pidgin English for my people to understand very well. Now let me explain something to you. You see, when one man married two wives, to one man, one Johnson, for example, no, not be Johnson. May we say which man name I go talk now? I not fit mention my husband because my husband name now native name. So which English name? For example, may we say Victor. Good. Shebi na men dey bear Victor. Yes. So man, Mr. Victor go marry Rose, number one. As he marry Rose, now so he marry Grace, number two. Victor na in dey center, so now Victor body na be the battleground, because when Grace wan stone Rose, he go stone her through Victor. When Rose wan stone Grace, he go stone her through Victor. Now so, and when these two wives now, Rose and Grace, come dey fight, una know now one must win the other one. So now so medicine be. When that your body na im be Victor, and inside that your body now you carry ibuprofen enter, now you carry hypertension medicine enter. You see, so the two medicine go dey fight, because the way medicine take dey work, dem be like key and lock. You know, when you put key for keyhole, you go twist am, e go open that door. Now so all medicine dey take work. When they enter body, e get where dem dey go hook themselves to. They go come turn am. When they turn am, then they go do wetin dem wan do. Dem go enter, do wetin dem wan do. That's why e be say when you take some medicine, you'll be say, "Oh, the thing dey pain," no, but when you take the medicine, after some time, the pain go go. Now be say that medicine don open door, e don go settle down. But if you can't take two medicine together, wey be say na the same door, two of them wan pass enter that place, but na different work dem wan go do, but na the same door dem dey pass enter, na im be say dem go fight. And when dem fight, one must drive one comot, because Rose and Grace, Mr. Victor no fit keep two of them. If Mr. Victor keep 2 of them, Mr. Victor not go last for life, he go die. Now so this body be. If you come dey take medicine, they take am anyhow. Take Grace, take Rose medicine, take Grace medicine. Grace medicine and Rose medicine go fight. One must beat the other one. Now so this medicine matter be. That is why in pharmacy, or that is why pharmacists always advise people not to or self-medicate, because why? You don't know if they will fight, if there will be a rival fight between them. That is what we call interaction. Interaction, that na medical one sha. Then the other big one wey dem dey call contraindication. Contra. Wetin be say contraindication? The medicine, you not suppose take am for that thing wey you dey take am for. It is contraindicated. Me, I no sabi that one. I can't explain that in pidgin English. You understand? And then again, there is another one they call disease drug interaction. Now they say get some kind disease, some kind medical condition where they say person go get. You understand? Person go get, because he get that condition, he not supposed to take that medicine. You understand? So patent medicine store no go fit explain this one to you, but your pharmacist go fit explain am to you. That's why e be say make una no carry una body just go anywhere. Make sure you go to the right place. If you wan knock for primary health care door, and you know say na that na chemist na be your own, wey you go fit first run to, no run to anyhow chemist, run to the one wey get pharmacist. If you read there, ask the person, are you a pharmacist? He go tell you. If he not be pharmacist, he go tell you. If he not be pharmacist and he give you medicine and yawa gas, you know wetin to do now. You go hold am. So that one don't finish there. Another one where I want explain be say, then they talk about say, no, I can't. I'm not going to continue with pidgin English anyway. Let me switch over. So I was discussing with someone, and then the person said, oh, in Nigeria they are fond of having this 3-bedroom hospital all over Benin City, blah 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 blah. This one, they don't have that, Yes, I know that you have this small hospital in Nigeria or in Edo State. Is a very common practice in Nigeria as a whole. It's not only in Edo State. Where am I taking you to? Yes, there is 3-bedroom hospital, there is 4-bedroom hospital. But you know why it is there? Because we are still developing. Yes, we are still developing. So there are some 3-bedroom hospital which are well organized. They are well organized. They know what they are doing. So when it comes to 3-bedroom hospital, my preaching there is, in 3-bedroom hospital, my preaching is, if you are the doctor there, don't act above your competency. No, do where you know, say you know, reach, not do pass there. If a patient comes to you and you know you are not specialized as a respiratory doctor, do not handle that case. Don't see that patient as a number. Don't see that patient as an additional money to your hospital. No, refer the patient actually to a respiratory doctor. Yeah, I have a program in Benin, and I so much love the doctors I'm working with, and I really want to commend them. Irowa Medical Center, Capstone Medical Center. I work with different people. Yes, their doctors are good. I'm not lying to you. They have nice doctors. I tell you something. Do you know we had a case, and when the case came up, I called on one of the doctors. They checked and said, "Oh, ma, let me tell you something. Oh, this is not my line. We need a cardiologist to actually assess this patient." I said, "Fine." Yes, because you know why? They can't lie to me because I know. You understand? They can't trick me because I know. So I said, okay, how do we get a cardiologist? This is where the comma is now. The comma there is, in here, like I said, I did the research in Edo, so I'm going to talk about Edo now. The thing is, the patient wants the doctor to come and visit at home. Fine. For you to move a cardiologist from the hospital, to move a cardiologist to come and see you at home, you are looking about 30,000 naira. That is it. Yes, 30,000 naira for a cardiologist to come and visit you at home. And that's about 55 or 60 pounds. I don't know. I'm not sorry. I'm not be a bookie. I'm not a be exchange rate. So don't take that from me. Yeah. So we had a case of a patient who was home and he was managing himself on a roadside medicine. He was diabetic and so on. But then when we visited, the wife said, please, my husband cannot move. I could understand with her because the wife does not drive. And taking the man to the hospital was a big problem. So the wife said, please, can the doctor visit? I said, ma, the doctor cannot visit. How can you move a cardiologist all the way from a Edo Specialist Hospital to come and visit a patient at home? That is money. The woman said, my dear, any amount we will pay. We want his life saved. Then what happened? Thank God. You see all these buses when they see, so they are ambulances. It's just that I advise, please, if you can pass this video to our, what's his name? Our amiable governor, Governor Norega Etwa Obaseki. Yes. Norega Etwa. Yeah. If you can give this advice to him, let them paint these our buses and let us know which is our ambulance. Yes, we need to know. So they now had to say, okay, what is come and use the ambulance to take the man from home to the hospital. So if you are listening to me now and you understand the ambulance care, if you are interested in it, please do go into it. If you want to buy buses to make a private ambulance business, do it. I can't do all. No, me, I cannot put my hand in that area. The one I'm doing is good, but we need an ambulance services. So if you want to know more, call me. If you want to join me in this race that I am in, come and join me. We need ambulance in Edo State, private ambulance. If you don't have I will give you patient that will patronize you, because most patients can't leave home because they are already they've used medicine to frustrate those innocent souls at home. You will see people with heavy legs and they are there, they can't move. Anyway, let me go to the story. So now the man, they had to send the ambulance and they now took him to Edo Specialist Hospital. God bless Governor Obaseki. It's a referral hospital. Referral. When the doctor visited and saw the man at home, he said, no, this man needs to go into the hospital. Thank God there was an intervention. How did the daughter even know about me? The daughter heard me talking on Facebook. That's the more reason you must share this video. The daughter heard me talking on Facebook. She took the number and said, ma, I heard one day someone was, no, yes, I heard there was a program as I was watching one day, one Ameya Oefe program on Facebook, and he was talking about you, and you called and you spoke about it. My daddy is not well. Can you help my father? So that was how we got to help that man. And to God be the glory. He was saved. You understand? So there are some situations you know where to go to. If you are aware, it will save your life. If you are aware, it will save your life. Please, please, please know what is going on. Another example I will give to you. Someone, I was called, oh, please, my uncle is having a waist pain. He said it's arthritis, is this, is that. You know, people self-diagnose themselves in Africa. So they said, is this, is that, is that, is that. So please, I want to register him. I said, okay, if you want to register him with me, you can do that. Send me the money, send me the registration money. Once you send the registration money, we take it from there. Just send me the registration money and the telephone number. I will call, and then the nurses will take over. And when the nurses visit, after that, he go and do a blood test. After that, he go and see the doctor and say, wow, for how much? I said, cheap. And when they saw, he said, wow, that's really good. Fine. We now took his uncle. He registered his uncle. We now took charge over the care of his, we now take charge of caring for the uncle. What happened? She told me it was arthritis, but I tell you, when we did our first test, we were seeing something that's so disturbing. Fine. No, it wasn't fine. No, it was not fine. I called her. I said, what did you tell me? He said, oh, he told me it's arthritis. He can't move his leg. His waist down is paining him. Blah, 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 blah. I said, oh, okay. I'm going to be open and sincere to you just the way it is abroad. I'll give you the report the way it is. Then you know what to do. This is not arthritis. This is what it is. And this is what you have to do. Say, wow, let me call the children. I was just sleeping one night when I got a call from the US. Oh, sorry, I heard you're the one in charge of my daddy's care. I said, yes, fine. Who are you? He introduced himself. I said, well, for confidentiality, I can't really tell you so many things. I can't tell you, but yes, I know who you were talking about, but I can't pass any other information to you. Until the father now called me from Nigeria and said, actually, he is my son. Talk to him. They are the one who will help me. I can pay. I said, okay. And really, we did. And to God be the glory for that intervention. So this man before was actually treating himself with a patent, not even pharmacy, with a patent medicine store medication. Who does not know what they were doing? So one has to be very, 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 very careful. Now, where am I going to? The 3-bedroom hospital, wherever, in every country in Western world, there's also a 3-bedroom hospital. If you come to London, you go to Harley Street, hear me well, Harley Street. The hospital there, they are not big hospitals. They are 6-bedroom, 4-bedroom, 5-bedroom hospitals. But who do you meet there? You meet with specialists. For you to do a consultation on Harley Street or your first registration, you're looking at about £450. So all those that were big men when they come from Nigeria, there then they go now Harley Street. They not they use NHS service because fear don't let them try them. NHS not go agree. Lie. So they go to Harley Street and they pay that money. But that's what I want us to change now in Nigeria. Let us encourage, let us empower our 3-bedroom hospitals back home. Let us give them a proper training, not the doctors, because me, I have worked with so many doctors who finish from Uniben, different universities in Nigeria. They are well trained. What they are lacking is equipment, the right medications. That's what they are lacking. And then they need support workers who will support them. Yes. As for me and my organization, we have embarked on a journey to help train healthcare support workers. So I'm not joking, I'm repeating it, healthcare support workers. If you could see on the screen now, RyanDanielsFoundation.org, go and visit that website. We have taken it upon ourselves to train any young adult from the age of 16, who are interested in becoming a healthcare professional support workers. They can come to us and we train them. Yes, we'll train them. The course is fully funded. Fully funded. You heard me well. There's no water not in my mouth. Fully funded course. If you want to know more, ask me after this video. Send me comment. Yes, I want this. Yeah, let this video go viral. Let it go viral. Let people see it. So we have already started with training healthcare support workers, because our doctors, if they get support, they go work well. Sometimes you see one doctor doing how many operations in a day? Please, they need assistance. They need assistants who know what they are doing. So 3-bedroom hospital in UK is fully equipped. Fully equipped. Everything is there. But when they see say the matter big past 3-bedroom, they go Oya, waka go the main Ogbonge hospital. That is the big hospital. They will go there. So 3-bedroom hospital is not a crime if the doctors there know their boundary. No, say look, he not be eye doctor, he na nyash doctor, and na only nyash go dey treat. I tell you, Nigeria is so big. Edo is big. Oh, you know how many people get nyash problem. So the fact that they carry eye problem come, no take and say money don't come. No, Leave am make him go meet eye doctor. Make you dey wait for people wey get nyash problem make you treat. For example, a gynecologist. How can you say you get belle problem? You get belle dey worry you. You carry go give gynecologist because the name na doctor. And my sister, my brother, that one now you dey kill yourself. You get to know the difference. Just like I tell you difference between primary and secondary care, you get to know. So for abroad we get different, say this na primary, this na secondary, but for Naija some of them mix together. Na im make me dey tell you now say for Nigeria e mix together, but e still good now make you come know say okay, the doctor wey I go meet, dem say that doctor na this e be o, na that e be. I could remember that time when I was growing up, I'll be hearing my mom saying Dr. Ediale, Dr. Ediale. So it's Dr. Ediale. Women only go to Dr. Ediale when they are pregnant, when they are looking for children. Dr. Ediale, they go to that Ediale hospital. Yes, that is all they do there. I believe the man was a gynecologist then, because yeah, I was very, very small, so I can't really tell more about him. But when they say it's woman territory and on everything about woman, that's what he does. So that's why I'm suspecting he was a gynecologist. So that is that. Then there's another one now that is really raining now. They say, oh, they have eye problem. They went to one village, Ogan. Where's Ogan? Ogan is Edo State. Okay, fine. What are they doing there? Eye problem. Which means in that Ogan hospital or eye clinic or eye center, they don't treat headache. No, they can treat headache because it has to do with eyes. They don't treat pregnant women. Maybe they have a session for pregnant women. Maybe they combine, but I don't know. But what they are known for is everything about eyes. Just like we have eye foundation. You understand? So, please, if you are listening to this video and you see these differences, make sure you share it and let people become aware. I'll be bringing another one your way very soon. Another interesting one, which is going to be next weekend. I'll check the date. It's going to be around that's 13, 14. I think on the 15th. Yeah, I think on the 15th. Yes, it should be 15th because Thursday is on the 12th, Friday is on the 13th. So it's going to be on the 14th. So on the 14th of November, we're going to have another beautiful live show, live streaming. We're going to be live again. And when you want to get full benefit of what we're doing, make sure you subscribe because you really get health awareness from us, health awareness information. So that is it. Oh, I've taken so much of your time. Don't get angry. I'm trying to make people aware now. Understand with me. Yes, I'm trying to make people aware. So, my beautiful people, my darlings, my sweethearts, please make sure you share this video. Let people know the difference between a primary health care and a secondary health care. So, like you can see, the Ekeadolo one is a primary health care. Obaseki write down openly for there. He say Ekeadolo Primary Health Care Center. You not tell you say that na Edo Specialist Hospital Annex, no, or branch, no. He say primary health care. So now that first door now you go for knock for any medical matter. That door now you go first knock. When the matter big pass them for that Ekeadolo Primary Healthcare Center, they go refer you with letter waiting then see. They go write and journal, refer you straight. So yeah, go Edo Specialist Hospital. You go there. So that one and for that one, you know the difference now. So people where they use mouth run 3-bedroom hospital, 4-bedroom hospital, every country for abroad too, then get 3-bedroom, then get 5-bedroom. So now the thing where they be say make the doctor them make them know their boundary, make them know where they go wakari, say oh me this not be my area, I no go there. Make them know they see people as money, because some doctors they said oh when patient keep flooding their hospital they will be very happy. Why? Because they are not looking at the patient as patient, they are counting the number of cars. Oh, how many patients coming today? Nurse will say sir we get 20 patients, 5,000 each. 5,000 times 20. Wow, how much is that? That's a big money. The doctor will be happy. That's inhuman. Very, very inhuman. No, don't count them as money, as an additional to your additional money coming to your wallet. Don't see them that way. Put them at the center of care. People will come and say thank you if you care for them properly. So that one is that. And again, if you're listening to me, I want to use this medium to appeal to you to support Ryan Daniels Foundation. Like I said, there is a program which has started fully in Benin. We want to train people from 16 years and above who wants to become a healthcare professional support workers. That's health givers who want to become carers, people who will help you care for your parents. If you are abroad, your parents back home, people who will go and be caring from them, caring for them, looking after them, giving them the right medication, giving them their medication when they are supposed to take it, helping to improve the compliance of your parents, improving the adherence, making them to adhere to the way they've been told to take their medication. So we want to train caregivers like that. And if you're watching me, even if you don't have elderly patient, but you can help us, support us to train a young adult, in Benin. You can donate to Ryan Daniels. Support us. Donate to Ryan Daniels, even if it is a penny, 5p, 10p, £1, £2, £3, $4, $5. You can donate to Ryan Daniels. Let me tell you one thing. If you are the type of person, you go to work and your lunch is £3 every day, you can say, because of Ryan Daniels, in a month I will be missing one day. So that £5 I use for lunch in a month, that £5 I will use for that day, I will donate it to Ryan Daniels. Or that $5 I will donate it to Ryan Daniels, which means one day or one lunch in a month you give to Ryan Daniels. And if we all come together like this, we will be able to really train as many people as are registered with us at the Ryan Daniels Foundation. So please, 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 we are appealing through this medium that you support us, and we really appreciate your support. Yes, we will appreciate your support. And then again, if you are in the UK, you want to support Ryan Daniels, you can support Ryan Daniels in so many ways. You can support Ryan Daniels in so many ways. Number one, you can make Tesco donate to Ryan Daniels. You can tell Waitrose to donate to Ryan Daniels. You can tell Amazon, eBay to donate to Ryan Daniels. How do you do this? I'm going to tell you. One, if you go online and type easy fundraising, it will bring you to their website. When it brings you to their website, then they will now say, sign up. When you want to sign up, register, put your name, that's it. And then they will now say, okay, support a cause. What do you want to do? You want to support a cause. So a search box will come up. On that search box, just type Ryan Daniels Foundation. You will see it come out. When Ryan Daniels Foundation comes out, you register. So which means you're going to support Ryan Daniels. Then you are not going to support Ryan Daniels with money from your wallet. No. Anytime you buy something from Amazon will say, wow, thank you for buying from us. Thank you so much. Because you buy from us and you want us, you said you are supporting Ryan Daniels, we are going to support Ryan Daniels. Amazon will now support Ryan Daniels. It could be 2p, it could be 1p, it could be 5p. Every little helps counts. Every little drops of water helps eventually make a mighty ocean. So if you want to know more about how you can support Ryan Daniels, please kindly get in touch with me. My contact details are in the comment box below. You can message me on WhatsApp or call me. And please, if you send me a question, if I don't respond immediately, don't forget I am a worker. So just give me within 2-3 days. I will definitely, no, within 48 hours, I will get back to you. I will respond back to you. So that is it. And I think I've taken so much of your time today. But yeah, thank you so much. Thank you all for coming. Thank you for listening to me. And again, please do not forget, share this video. People need to see it. People need to see this video. They need to know the difference between between primary care, secondary care, and tertiary. Oh, before I go, tertiary care. Sorry, I didn't mention that. Tertiary care and secondary care, they are they are the same. Not really the same, but is they are together. So, like we have tertiary care still inside this Edo Specialist Hospital because it's in the same settings under the same umbrella. So yeah, maybe next time, because I don't want to take too much of your time, next time I will talk more on tertiary healthcare. And if you know there is a topic you think people will want to hear with regards to healthcare, do not hesitate to draw my attention to it. I will talk about it and then we'll look at it further. So, like there was a topic people asked me to talk about, which I spoke about. I've done the part one, which is when a man's pen drive is under attack, under diabetic attack, yes, under the attack of diabetes. So I spoke about it, and so many people are still requesting, no, you have to talk about the part two, or how can hypertension attack a man's pen drive. I will talk about that in my next video. So thank you so much for listening today. And I will see you on the 14th. Like I said, I'll be live on the 14th in the evening. So I will let you know 3 days before. I will send out an invitation. Yes. Thank you, thank you, thank you so much for coming. Remain blessed. Do not forget, if you are not subscribed, please do subscribe down. And again, if you know you have not shared this video, please do share this video out right now. Thank you so much. God bless you. See you next time. Bye.